Hi Jo, and welcome to the SOOT podcast.
Thanks so much for having me.
So you're an occupational therapist who works in occupational health.
I
Can you
do.
talk about the difference between the two disciplines?
I can. So, occupational health. Um, so, we all know occupational therapy is a profession, whereas occupational health is an area of practice. So, no different to stroke rehab or palliative care. It's just a different area that we can work in. So, in occupational health, when they say occupation, they mean work, vocation, employment. We mean meaningful occupation, but certainly that includes working, and that's becoming a bigger focus at the moment within government focus, and therefore within RCOT, it's becoming a bigger driver. So I thought I'd just explain a little bit more about what occupational health is, as we all know what OT is. So occupational health, most of what it is management referrals. So that's when somebody's health, an employee's health is affecting their work, or their work is affecting their health, they will get referred to occupational health for an opinion on their fitness to work or ability to return to work. And that's usually done by a nurse, but can be done by a vast range of occupational health professionals, including OTs. There's another part of occupational health that I would say isn't the domain of occupational therapy. So things like health surveillance, if you're doing a particularly risky job, a high risk job, and you might need to have your, so like working at height, working in enclosed spaces, you might need to have your heart, blood pressure checked, or vision, things like that, to make sure that you're fit to do the job. Also things like vaccinations, flu vaccinations, Hep B, things like that, managing needle stick injuries, what's the other one? Drug and alcohol screening. So that's a part of occupational health I would say isn't so much the domain of occupational therapists. I think we sit very comfortably in the bigger part of occupational health, which is what I like to think is the VOC rehab bit, the supporting people to stay in work, return to work. I think that's very much where we sit. So we can do that management referral piece, but we can also do lots of really fun specialist, what I call specialist assessments, but actually it's OT stuff. So whereas our nursing and physician colleagues may not feel so confident with things like cognitive or neurodivergence or complex musculoskeletal, vision and hearing, chronic and fluctuating conditions, OTs can do those assessments because we can do that really complicated biopsychosocial assessment and get down to the nitty-gritty of their function. So the diagnosis isn't the most important thing. It's always about what that person can and can't do. Right, so I've gone on a very wafty journey, but I think let's summarise what occupational health is and roughly how we fit into it.
Thank you. I was going to ask you next, why are OTs so well suited to work in occupational health? And you've sort of answered that already. Is there anything else you could say around that?
Yes, this is my favourite thing to talk about, why OTs are so great and fit into this area of practice. So the main thing I think for OTs is it's just such a big and meaningful area of occupation for people. I mean, like meaningful doing. For a lot of people, it's why we get up washed and dressed every morning. It's why we get up at a certain time. It's how we contribute to the family financially. It's got a huge amount of meaning for a lot of people. And also it's the word vocation means our voice, our calling. It's so linked to identity. We say I am a teacher, not I do teaching. So as occupational therapists, how can we not be the main profession in this area of practice when it's just so perfectly aligned to our degree? I think OTs, with our focus on function over pathology, sets us up really beautifully on this, because that's what employers want to know is the function of any condition or conditions, rather than what medication they're on or what treatment regimen. Like it's how does it affect that individual, and can they do that task, not how does it affect them overall, but can they lift 5 kilos, or can they concentrate for 5 hours? What's the functional impact. I think that's and also the breadth training, because we're not just described as dual trained. I like to call it holistically trained, because it's not just two, it's all conditions. I think in occupational health, your clinic list for the day might include somebody with a terminal cancer diagnosis, or visual impairment, or it's just so broad that our jack of all trades ability sets us up really beautifully for it, I think. I work a lot with occupational therapists that work in occupational health, and almost without exception, they all say this is the most OT I've ever felt. Like, I use my OT degree all day, every day in this job role. It's perfectly suited, I think, to this and VOC rehab, which is very, there's a huge overlap and very well aligned. I think it's just a lovely fit, I think.
Thank you. And can you give some examples of some of the cases you've worked with within occupational health, just to demonstrate how diverse the professions of people you work with are, and some of the different health conditions you might work with?
Yeah, it's my favorite thing about this job role is the diversity. I'm a bit pingy and get bored, but I've just never had 2 days the same in this job role. So I've written a little list that I was hoping would kind of capture the breadth. So I've assessed an engineer surveyor with an upper limb injury. That's a really physical job role, climbing all over heavy plant machinery. A cleaner in a hotel with a terminal cancer diagnosis. A rocket fuel scientist with lower back pain because he had to use some unergonomic chairs in the lab. A director of a well-known supermarket who's recently diagnosed neurodivergent. A forensic psychologist who had a visual impairment. And I've been to the Cabinet Office to do, it was a DSE assessment, a display screen equipment assessment, but you just get to go to the coolest places and do the coolest assessment with the coolest, most diverse people. It's just absolute privilege, this job. Real privilege.
Thank you. And what motivated you to work in this field?
So I was lucky enough to have a third year role emerging placement in a VOC rehab secondary mental health service. So I and had an amazing OT there who just really lit me up about vocation and like why aren't we all doing this? Told me about the research and the kind of history of occupational therapy, and that's why we were invented. Like that's why the profession exists, is for work stuff. So but we've gone away from that. So, and I feel like we're coming back towards that now because it's so part of the core of it. So the more I looked into it, the more I was like, this really fits. And I feel like an authentic OT in this area of practice. And I kind of fell into an OH job, kind of accidentally turned up there thinking that I wasn't really gonna have a proper interview, and then got offered the job, and then huge imposter syndrome, with all the clever doctors and nurses around me, and then just flourished there. Not because I think I'm in anywhere an above average OT. I think just because of my OT skills was just so valued in that environment, and I've just since then just got. I felt very lonely in it to start off with because I knew no OTs that did it, and I was approaching the Royal College. I was approaching everybody I could. And I just found a small handful of OTs. I really thought I was one of like 3, 4, maybe 5 OTs in the whole country that did this. So I started a network. There's now 200 of us that regularly get together. We share best practice, and that kind of community has kept me in this area of practice as well, knowing that we're all on the right page. We're all doing the same thing. We're all kind of valued in our various areas and to support each other. I can't remember what the original question is. I think I've gone off on a bit of a tangent as I do.
No, you're fine. About your motivation to work in occupational health.
Yeah, no, I think that's it. It just the really, really close fit and the comfort within my skill set, and that I can remember things from my degree that fit me into this, the person, environment, occupation, the PEO model, just yes, I see those things I'm doing. Like just all, yeah, they kind of all made sense.
And you mentioned imposter syndrome, but you still went for the job and have succeeded really well. I suppose, what advice would you give to any OTs listening, or any OT students who they see a slightly non-traditional role and they're interested in it, but they feel this imposter syndrome and it might be putting them off applying for it?
It's so hard, and I don't know any OT that doesn't experience imposter syndrome. And as I say, I know a lot of them, and that's, I think, because occupational therapy can be very hard to articulate. But from an employer's point of view, I like to give them kind of deliverables that OTs can do. What's the function of our job role? So we can do. So I like to describe that we're an efficient use of resources. I don't like to call us cheap, because we're, why would you pay us any less than a physician when we do such a fabulous job? But we're a very efficient use of resources. So you can reduce touch points by just sending one person to an OT, because we can assess mental health, physical, cognition, hearing and vision. Like, I think that's a really strong selling point. And just, I think mostly it's a numbers game. I think you come across lots of employers who don't get OT, or just are only interested in, the job description, the really basic job description, and won't be interested to go outside of that. And that's their problem, not yours. But I think playing the numbers game and just approaching as many as possible, you'll find an enlightened person or an open-minded person that will listen, give you a trial. And so you can really show that and demonstrate skill with kind of with a low risk for them. I think that might be a way forward. I've done that before.
Yeah. And you mentioned how holistic we are, but then some of the specialisms you mentioned, like the vision, we do need extra training in. It's not, we don't learn all of these skills university as such. Have you found within your job roles in occupational health, you've come across other things that you think, actually, I need to hone up on these skills and get a bit more training or qualifications in?
Well, in occupational health, I think there's no better training than the OT degree. Controversial to say, and I've had heated debates with my nursing and physician colleagues, but I really believe that we are the best possible profession to be doing management referrals straight out of uni, day one out of uni. I think OTs are really well set up to do that, because I don't think we need to be condition specialists. I have assessed people with some rare genetic condition that I've never heard of. I've done some background reading on it, of course, but I don't need to understand the pathology of it necessarily. I don't need to understand the medication that they're on. I need to understand how, because you could have 10 people with the exact same, cancer diagnosis, the exact same treatment regimen, the same age, same gender, but each of those 10 people are going to have exquisitely different experiences. So I don't need to understand their condition in that much depth. I need to understand how it affects that person. I need to understand the task that they're required to do, a unique skill of occupational therapists. Other professions don't have that task analysis, that activity analysis within their undergraduate training. And I need to understand the environment in which they do that task. And as soon as I understand those three things, then I can assess any condition as an occupational therapist. Whilst additional training is helpful, I don't think it's essential. I think what is essential is understanding that individual's experience, their functional capacity, the task, and the environment. And as soon as you have those three things, the condition-specific knowledge becomes less and less important, I think.
Thank you. And you set up and ran a recruitment agency called OT4OH, which is amazing. Can you talk a bit about the journey of this?
Yeah, so after being very lonely in occupational health and starting this network, I realised there was loads of OTs that wanted to work in occupational health. And by then I was doing some work with the Royal College on the National Executive Committee for the Specialist Section for Work and the Society of Occupational Medicine. And I was aware that there was this huge need for OTs in occupational health, and this huge bank of OTs that want to work in occupational health or already do have that experience and are looking for other opportunities. And I kind of felt they got to a point where I was like, well, I've got no choice but to start a recruitment agency to put these two together. So I retrained as a recruiter, and I started a website. I did all that stuff, and I had a fab time being a recruiter, but it's just not my cup of tea. I'm an OT. You cut me and I bleed green. I'm OT to my core. And being a recruiter, there's a fair amount of schmoozy stuff that goes on and negotiating the rates. And I just want to introduce lovely people to lovely people again at work. So, and also, so I went on maternity as well, and coming back from that, I'm like, I just want to be an OT again. But it was an amazing experience going out there and I still deliver the free webinars that I did on that recruitment agency to get OTs into it, because it's just so enjoyable and just so refreshing to say, yes, you're an OT and you're perfectly skilled for it. Look at all your skills and look where you can work. And I still enjoy doing the OT promotion side of things to occupational health. We had a fab webinar recently, joint webinar between the Royal College and Society of Occupational Medicine and RCOT about leadership, OT leadership in occupational health. So not only can we go into this, but actually there's a really amazing career path here. And I was dangling in front of everybody Ryan Winch, who's the head of occupational health for Google, and he's an OT, so I enjoy that kind of promoting side of things as well. So I still do a lot of recruitment-ish things, but without actually being a recruiter, because that's not what I want to be when I grow up.
So is this the Robin guy you mentioned? Is he American if he works for Google?
Ryan Winch, he's Australian.
Okay.
And Australia have their undergraduate OT training is really, really good at, like, if you meet an Australian OT in the UK, they'll get vocation. There's a lot of them that work in occupational health. Australia, also New Zealand, South Africa, Canada, OTs who have trained there, particularly, there's these little pockets of OTs that really get vocation and VOC rehab, partially because the insurance income protection thing's a bit different there and it's just set up for it. But yeah, Australian OTs particularly are stonking at vocational stuff.
And do you know, do they tend to work in occupational health roles more than in the UK?
Yes, occupational health, workers' comp, and the various kind of insurance and or benefits assessments tend to be more vocationally focused. That, things like that. There's a lot more vocational focus, and you'll be much more likely. I've heard Australian OTs come to the UK and be like, "What? But I work in vocation. Where are all the jobs?" This is very, they're really confused about that. I've got to go stroke rehab like this. This isn't what I trained for. They'll be a bit more confused about it. It's very strange.
That's really interesting. It'd be great to hear more about your webinars as well. So do you do webinars for OTs who just want a bit more information, or what's your focus?
I just do the same webinar really, and it's all about, it's a lot of stuff I've covered here, just explaining the OT, why and how the OT undergraduate training perfectly suits OTs up to work in occupational health, and what occupational health is, because there's a lot of confusion around it, that you need to do a whole degree's worth of occupational health training to do that. So demystifying it a bit. And I used to have when I had a bit more time, and I used to do a bit on ergonomics, a bit on neurodivergence, and a bit on kind of OH ethics and legislation, which is handy to be aware of, but like really light touch stuff, but just to kind of give that confidence for interview skills, really, if you're going to go into occupation health, just a little bit of kind of the nuts and bolts of the kind of clinical stuff that you might need in occupational health as an OT. And there's talk of setting that up, and I'm in chats to maybe doing a bit of consultancy, setting that training up with another company, so that you can have just like a relatively affordable online like module where you can just say, yeah, I want to top up my ergonomics knowledge, or I want to top up my mental health knowledge, or because you may have only ever worked in pediatrics or only ever worked in mental health, and that breadth of skills OTs sometimes don't feel so confident about. So that kind of topping up to bring back the breadth of, remind you of the breadth of your training. That's kind of in the wings, but that was the idea behind it.
That sounds brilliant. And in the UK, are you aware of any OT student placements within occupational health settings?
I wish there were more. I know there's a bit of a placement crisis at the moment, generally, and in occupational health, it varies a lot. I know there's a few. So if any OTs are interested, I'd join the network and just put your feelers out there, because there's loads of OTs that work in occupational health, and they'll be able to say, oh yes, we do, or no, we don't. And yeah, so I know there's some NHS ones that do. A lot of the private places that hire OTs to do the specialist assessments choose not to. And their reasoning is that it's just that bit too specialist, that bit too complicated for students to do those kind of things. I would argue they're particularly well placed to do it, and it was a great placement, but I see where they're coming from. But certainly I would say the management referral stuff and VOC rehab stuff is perfectly suited for students, if not the other stuff. So there are some here and there, but an annoying shortage.
And you said encouraging people to join the network. How do people join your network?
So they can go on the website. Is there going to be show notes? Can I put some links?
I can put your OT for OH sort of website address in.
Yeah, yep. So on the website there's links to all of that. There's the way to join the network and sign up for the webinars, and they're all free, and it's a really lovely community, the OT for OH network. Mainly because I'm just dead informal. I can't do anything other than let's have a chat and open a bottle of wine. So it's just nice and chilled, and everybody's there. Nobody's judgmental. It's all very welcoming and friendly. So if you just want to pop onto one of the meetings, ask a question, put a question in the WhatsApp group, it's very welcoming, and yeah, nobody's gonna say anything shocking.
Thank you. So OTs are interested in this field. How can they learn more if they feel like they want to gain more skills or qualifications for this work? I know you're saying you feel that the OT degree is enough, but is there any other things for people that are really feeling that imposter syndrome and want to sort of beef up their qualifications a bit?
So the So it depends what area you want to get into. So there's vocational rehabilitation training. And you can look on the Vocational Rehabilitation Association website, and they've got a good few options there. There's ergonomics, and if you were to go into the ergonomics side of things, I need to Google that, but there's I think it's the Chartered Institute of Ergonomic Practitioners, something like that, and they've got kind of courses that they accredit anything from, I think, half a day up to, you know, a degree level stuff for ergonomics. There's functional capacity evaluation training, so that's a very standardized way to assess somebody's functional capacity in a kind of protocoled way. So you might be doing, so you'll always start with safety stuff like blood pressure testing, you'll have a heart rate monitor on, you might do lift strength testing, grip strength testing, and there's kind of lots of standardized a battery of tests that you'll put together. That training is quite hard to come across, and it's quite expensive, but it's been really, really useful in my career, and I'm really glad I've done it. So you can, I think there's you can do it virtually via Matheson's, who's the main kind of industry leader for it. They're over in America, I believe, and you can do that online, I think. There was a training provider in the UK that did FCE training, but they're not at the moment. But there is Aubert training that do a short form functional capacity evaluation training. And if you join the network, I've kind of advertised when those come out. And that's a couple of days training, and it sets you up to do functional capacity type assessments, which is perfect for occupational health. If you wanted to go down the formal occupational health training route, there's you could do the Faculty of Occupational Medicine diploma. So that's a 10-week course delivered over 2 hours twice a week. So it's relatively light touch in terms of time commitment, but the stuff that they cover is pretty full on, and it covers loads of stuff that I would argue isn't completely relevant to OTs, like the health surveillance stuff, the needle stick injuries, things like that. And it's quite expensive. It's around £2,000 to sit to take the course, and another £1,500 to do the exam. So I'm not sure it's necessary for an OT to do that. Certainly isn't essential to work in occupational health. If you've been in OH for like 5 years and you want to do career progression, that might be good for awareness, but maybe not even then. Do you know, I've been in it for 10 years and I managed to sit it for free, managed to do the course, but decided not to do the exam because it's just so expensive, and I don't think I need it in my career as an OT. If you're a physician and you're going to get a kind of day rate of £2,000 or so, the return on investment's pretty clear, but not so much for an OT, I think. Yeah, but I would just start with the OT for OH webinar because it's free. I've got loads of pre-recorded YouTube stuff, webinars, just to kind of build up awareness. But and there's loads of other organisations which should I rattle off a few that have like really good. So the Institute of I think it's the Institute of Occupational Health, IOH, little I, big OH. They do loads of great webinars. Oh, are you still there?
Yeah.
Membership is only a tenner for them, and they've got lots of OH specific stuff. The Society of Occupational Medicine do lots of good webinars, and they've just done a series of OH basics to take you through all the kind of nuts and bolts of it. So I think that's a good series to do. And of course, there's the specialist section for work for the Royal College of Occupational Therapists. They are currently being reimagined into communities rather than specialist sections, but I know work and health is going to be a big part of that. So stick around there because that will be free as a part of our COT membership, and there will be work-specific training and not training, but hopefully training one day, but definitely webinars around occupational health and in this area of practice and vocational rehab as well.
Thank you. And on to the last question. So OTs that are interested in this field, where would you say to look for job opportunities? Because I think a lot of us are very habituated. We look at NHS jobs, social services, maybe Indeed.com, but occupational therapist jobs. So where would you say to look for job opportunities, and what are the sort of job titles we should be searching for?
So they do come up on NHS jobs. They're not always occupational therapist titles, but they can be. Sometimes they're rehab specialists, sometimes they're occupational health advisor. Sometimes it's functional assessor. You know, that's why I felt that a recruitment agency was needed, because just that algorithm of occupation and occupation gets lost, and it's just inherently hard for lots of reasons. But yeah, do look on NHS jobs, search for the word vocation, search for the word for occupational health, occupational therapist, but also in Indeed, so OTs can work as occupational health advisors, and I've been employed as occupational health advisor before. It's not a protected job title, which is why I could work as one. And that means you'll be doing management referrals. You can apply for any occupational health advisor job role that only does management referrals. Some of them will say the full OH remit, and that's going to be the health surveillance stuff and the drug and alcohol screening that isn't our bag. So we can't do what they call the full OH remit, but we can do stuff, management referrals, which they refer to as case management. So you can go for occupational health advisor job roles. Can't go for OH nurse job roles, because that is a protected title and you need to be a nurse. But a lot of recruiters won't understand what OT is, or they might think that you're a bit confused about what occupational health is. And I've had that argument with recruiters multiple times, and I do a bit of a, do you know who I am? I'm sure that, but I think it is a bit of a numbers game, and you do just need to apply for loads of jobs, and eventually there'll be people that get it, and that know what OT is. There are the two biggest occupational health providers in the country do hire OTs regularly, mostly to do specialist OT stuff, but also sometimes as occupational health advisors, and their health partners and Optima Health. And there are also smaller rehab companies that do a bit of occupational health, but they also do kind of VOC rehab, functional capacity evaluations, for the income protection market or the medical legal market. So you can use your skills there. It's companies like Rehab Jigsaw, Form Health, Ergocom. They might be places to go, and they take on associates as well. So if you want to kind of dip your toe in the water, reduce your kind of your statutory work, and try this out, they're really supportive and might be worth a try. I'm sure there are loads of companies as well that I've not mentioned, but those are potentially some good ones to start with. But the job roles will come up, but also all the networking. So go to, join the Society of Occupational Medicine, the IOH, join some Facebook groups, and just put out there, like, I'm an OT, I'm interested in this area of practice. Anybody got any advice or support or job roles? And join the free OT for OH network and ask there for advice and support and signposting. People are looking for OTs, but it's a bit of legwork and graft to find it.
Thank you. Anything else you want to say to anyone listening to inspire them to get into occupational health?
No, just to underline that it's just, I know I'm potentially overselling it, but I don't think it's possible to oversell it. It's just the most glorious area of practice for OT. It's just so satisfying. And just when you're working with somebody, it's a million times, 99 times out of 10, 99 times out of 10, 99 times out of 100, you're working with somebody on something that's just so deep and meaningful to them, and you're just completely on the same page. You're getting right alongside them through the medium of an occupation that's just deeply, deeply linked to their identity, and you're supporting, enabling that return to work. That it's just deeply, deeply satisfying. I can't underline enough what a glorious area of practice it is. I really hope that people are getting it, and that we're flooding into this area, because there is this huge governmental focus on work and health now. The job roles are coming, so definitely wiggle in this direction, because and ask other people about it, because I think all the OTs I know would completely agree that it's just the best area of practice.
Well, thanks ever so much for talking to me. You've definitely inspired me to look more into it for myself, actually.
Great. Oh, you're very welcome. Join the network.
Well, thanks very much then, Jo.
No worries. Thanks so much. Bye.
Thank you. Bye-bye.